Suggestion is ours, decision is yours.
Yes. Okay. Yes. Yeah, you can start now. Yeah, Srija Ravindran. Yeah, I will. Next is your writing correction after Sukhvinder. Nobody else is there. So, Srija Ravindran, you can start now.
Okay. Good morning.
Good morning, nurse.
My name is Swapna Sree, one of the registered nurses working in this community health center. How may I help you?
Yeah, actually, nurse, I have high blood pressure and I have been referred to you for advice regarding lifestyle changes. And
Okay.
yeah, the doctor suggested me to meet you.
Okay. Could you please tell me your name and age for documentation and better communication?
My name is Lincoln, Abraham Lincoln, and you can call me Lincoln. And I am 40
Okay.
years old.
All right, Lingan. Could you please tell me more about your problems?
Yeah, actually, I have some issues, you know. I am facing stress and concern.
Uh-huh. Okay, Lincoln. In order to get better understanding, I would like to ask you a few questions regarding your lifestyle. Shall I?
Yeah, definitely, please.
Mr. Lincoln, how long have you been experiencing this high blood pressure?
Yeah, tell me, please.
How long have you been experiencing this high blood pressure, Mr. Lincoln?
I have been experiencing this for the last 7 to 8 months.
Okay, all right. Could you please tell me about your dietary habit?
Yeah, I normally eat well, but sometimes I
Okay.
skip meals.
Okay, all right, Lincoln. Do you have the habit of doing some exercise regularly?
Uh, I want to do exercise regularly, and earlier I was doing, but now, you know, because I am little bit stressed and I am doing a work as a lawyer, and
Right.
it's very stressful and it gives me a lot of tension, you know. Because of that,
Okay.
I'm not able to participate in regular daily exercise.
Okay, due to your hectic lifestyle, you don't get time to exercise. Am I right?
Yeah. Yes, of course.
Okay. Um, I am afraid I would like to ask some personal question. Do you have the habit of smoking or drinking?
Uh, yeah, of course. I smoke one packet of cigarettes every day, and I will drink a couple of drinks every day.
Okay, Mr. Linga. How long have you been in this habit?
Yeah. I think I can tell you this has been for the last 3 to 4 years. I have been smoking and drinking.
Okay, Mr. Lincoln. One more last question. What do you, yeah, you said you are a lawyer, working as a lawyer. Am I right?
Of course, nurse.
Thank you, Lincoln. Thank you for your valuable information. From your words, I can understand that due to your hectic lifestyle, you are leading a unhealthy lifestyle pattern. All right.
Yes, nurse.
So it is very important to make some modification in your lifestyle. Otherwise, your life will be in danger and you may prone to get some serious illness like heart disease, stroke, liver damage, etc. But don't worry, we all are here to help you. I can suggest few measures that will help you to escape from all this habit. Shall I?
Yeah, of course, nurse.
Mr. Lingan, first and most important thing is you have to make some modification in your dietary habit. It is recommended to include some green leafy vegetables and nuts in your dietary pattern that will help to strengthen your heart and reduce blood pressure. Will you able to
Okay.
follow that?
Yes, of course, nurse.
Then secondly, you have it to reduce or quit the habit of smoking and alcohol. I know it is very challenging for you, but I would like to insist you to quit this habit because it will, if you will continue this habit, it will have a long-term dangerous effect in your health. Are you with me?
Yeah, of course, nurse.
Okay, so I can suggest few measures. First and most important thing is you have to take a firm decision. That is an integral part. All right.
Okay. Okay.
Secondly, I would recommend you to quit this habit gradually. That means not all of a sudden. Okay. For example, if you take 10 cigarettes today, tomorrow you can take 9. Gradually, you can reduce the number of cigarette and number of packs per day, and finally you can quit it gradually. What do you think?
Yeah, of course, nurse. What you say,
Then,
I can understand very clearly. But why
okay.
should I reduce my cigarettes and drinks? What is the reason? Many people are smoking and many people are drinking. Why you are asking me to stop this one?
Mr. Lingan, I can understand your concern, but try to understand that your blood pressure is now little bit high. If you continue this habit, it can affect your heart, lungs, brain, kidney, almost all the vital organs because smoking can cause blockage in your blood vessel and it may leads to heart disease, stroke, etc. Okay, this moreover this alcohol also can increase blood pressure. So it is very important to reduce and quit this habit. All right, hope you got the point.
Yeah, of course, nurse. Stopping smoking is definitely a Herculean task for me because it's not always possible. I have been smoking for the last so many years, and suddenly stopping will be hectic for me, and it may give
I
some
know,
negative
Lingan,
impact.
you might be reluctant to stop smoking, but it is my humble request. It is important to reduce and quit this habit. Otherwise, your life will be in danger. All right.
Okay, nurse.
So you can also do some diversional activities to reduce the urge to smoke and drinking. Like you can spend some time with your family or watch comedy movies or go for a walk. All this help to divert your urge to smoke or drink.
Distractive
Okay.
measures.
Yeah, distractive measures you can practice.
Okay, nurse.
Okay.
Definitely, I'll
Then,
follow.
have you ever tried to quit this smoking and drinking?
I tried 3 or 4 times, but I was helpless and I could not.
Yeah, I really appreciate your efforts, but don't worry, I can help. We can help you to quit this habit. Lastly, you can practice some yoga or meditations. It will help to reduce your stress. As you informed, you are doing a hectic life and you have a lot of tension at your workplace. So by practicing all these measures, you can reduce your tension. I think stress may be the reason. That is why you are doing this smoking and alcohol. All right.
Yeah, of course, nurse. Maybe.
Yeah. I I hope by practicing all these measures, you can quit smoking and drinking, and you can lead a healthy life. This will help to reduce your blood pressure. And along with the medication, I can reassure that within few months, your blood pressure will be normal, and gradually you can reduce the dosage of your medication. How does that sound?
That's very fine, nurse. Definitely we can go like that.
Okay. Hope you will practice
I
all these
will
measures.
try my level best to reduce.
Okay. Thank you, Lingan. Thank you for your understanding. If you will face any difficulties, you can contact us. Okay. Moreover, I can provide you a leaflet that contain all this information, so you can go through it and practice that one.
Yeah, fine.
Okay.
Definitely,
Thank
nurse.
you.
Thank you once again.
Thank you, Lingan. Thank you for visiting.
Yeah, right. Now let us see here. Yeah. So, the points which are based on the discussion, what we have done on the speaking interview or role play. I don't know why you are saying cute. What is this cute? It's quit. It. It's it. Quit. You are saying cute. Yeah. So it's not a proper, you're not pronouncing it properly. Okay. It's not cute. It's a quit. 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 That's it. So practice the sound. Quit. Like a quiet. 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 Quit. Okay. So next second thing is, if you will continue, it will. So what do you mean by if you will continue? So here in this sentence, you have used two times will. You cannot use two times will in a single sentence. This is a conditional sentence and with condition if. So what you have to do is, if you continue smoking, it will harm your body. If you continue smoking, it will harm. So if, wherever if is there, will not come. But you are saying if you will continue. No, if you continue, remove that will from there. Next one, you are repeating this word quit. Again, pronunciation wrong is one, but you have told three times quit, quit, quit. You would have used stop, cease, stop, cease, quit. Three times, three words. Why are you using three times quit, quit, quit? You don't have any other word other than quit. That's what people will think. So be careful. Okay, next one. It may leads to. It may leads to. No, it may lead to. It may lead to. It may lead to. So that's it. Next one is, if you will face any difficulties, you can call us. If you will face any difficulties, you can call us. So if you will face, wherever if is there, will be removed. And will be only in the other part of the sentence where will is not there. Two parts, if clause and the main clause. So in the main clause will be there. If clause will not be there. If you come to my home, I will give you a chocolate. But what you are saying, if you will come to my house, I will give you a chocolate. So double will, that's not right. If is a conditional, so no tense there. Then next one, pronunciation, grammar, vocabulary, fine. You have to work out on your vocabulary more. Then idea generation. So what is idea generation? How to build up a plot is very important. How to build up a plot, how to construct the story is very important. So I'm going to show you how to construct the story here. For every different student, I'll give you different versions. For example, Avil is there. He's attending all the speaking sessions. Some people went in middle. See, for example, Deepak Moili came and attended one session and went off. Then Sarvesh, okay, Rajeshwari, she attended a session and went off. But Avil, from the beginning to the ending, he is there. So he is learning all my suggestions, whatever I'm giving. Because never I give the same points to everyone. Because they are on the YouTube. You can go through them and you can listen. So if I give the same things, there is no need to give feedback first of all. So I'll give you different versions and different variations. So variations I'll give you, different styles I'll give you. Now here, I absolutely understand your condition and the reason for not accepting my suggestions. Yes, you have been smoking for the last 4 years and drinking also almost the same period. Now, all of a sudden, stopping smoking and drinking maybe not very convenient for you. You have got habituated to these smoking and drinking. So, it's genuine. Your concerns are genuine. You're saying you cannot stop suddenly. That's fine. Yeah, it's an option. So, because of smoking cigarettes 10 per day on a daily basis for 3 to 4 years, and at the same time, drinking alcohol, a couple of drinks every day for almost the same period, yeah, you know, in the short term, it is giving you pleasure, it is giving you relief, happiness, some sort of ventilation to the stress building in your mind. Of course, I agree for that one. That's definitely positive. But what about the long term effects? The impact of smoking and drinking on your lungs and body and your brain. Okay. Long term effect. Today you are taking 2 drinks. Maybe after 1 year you will take 3 or 4. Today you are taking smoking 10 cigarettes. Maybe after 2 years you will smoke 20 cigarettes. So it goes on like that. And now is the time you have to put a full stop. You have to decide for yourself. Suggestions are mine, but decisions are yours to implement. Take a wise decision. You're mature enough. You know the best, what is good for you. After careful reasoning, come to a decision and then implement that decision with your body, mind, and spirit. Yeah, suddenly ceasing smoking and drinking is difficult, but there are other options too. Gradually reducing until you are comfortable and minimizing to 2 or 3 cigarettes per day would be better. And instead of drinking uh, liquor every day, drinking on all alternate days or on weekends or occasions, social occasions would be better. So this way you will limit yourself, control yourself. So in the long run, you will put an end to these habits, or at least you will reduce the quantity or the number of cigarettes. So this is the way how idea generation comes. And subject knowledge. Subject knowledge. Now, lifestyle modifications are very essential, especially when the impact of the lifestyle, present lifestyle, is negative. If the orientation of your lifestyle is leading to negative impacts or results, then definitely you have to take a second opinion. Short term relief or long term gain. Your health is of importance, primary importance. Health lost, everything lost. So maintain your health properly. So for that, refraining from negative habits is recommended. If not the smoking cessation, at least reduction in the number of cigarettes you smoke on a daily basis would be pretty fine. Today one, tomorrow another, day after tomorrow another. So gradually, if you go on reducing 1, 2, 3, 4, like that on a daily basis, at the end of maybe 10, 15 days, you can minimize to, it may be total cessation of smoking or minimizing to 2 or 3 cigarettes per day. How does that sound? So this is your subject knowledge. Medication complaints, reduction, smoking cessation. Right. That is regarding lifestyle modification. In addition to reducing smoking or cessation of smoking, so now you will have not have anything to do. So you cannot relieve your stress. So after 1 day or 2 days or 3 days, you will get back to smoking. So what you have to do is, whenever you decide not to smoke, you treat yourself with a gift. Like you have a chocolate, or you listen to an audio song, or you watch a comedy video, or go for a walk, have a fresh walk in the streets in the evening, do something. So these are not detrimental to your health. These are good practices also, and these may be substituted in a positive way to the negative habits. Gradually, your bad habits will decrease, and the number of cigarettes you smoke will be minimized, and then you can spend on many other things productive. Now, this is the way how you can speak. Many things are there you can speak. So that is Swapna Sree. Yeah. Do you have anything to say, Swapna Sree? If you have anything to speak, you can unmute and speak. Otherwise, we'll move on to the next candidate. That is Sukhvinder Kaur. Yeah. So that is